India is experiencing a significant increase in dengue cases this year. As the monsoon progresses and the environment contains a lot of moisture, it creates ideal breeding conditions for dengue mosquitoes. Dengue outbreaks are currently affecting cities in Karnataka, Kerala and Maharashtra the most. For instance, Dr. K. Somnath Gupta from Yashoda Hospitals in Hyderabad told News 18 that he has been seeing 200 cases of dengue positive per week as of early July 2024.
India is experiencing a significant increase in dengue cases this year. For instance, I have been seeing 200 cases of dengue positive per week as of early July 2024. On an average, around 30 to 35 cases are being reported daily in both OP and IP wards. The uptick in number of cases has been observed since the onset of monsoon season, which typically because of mosquito-borne diseases due to increased breeding sites of mosquitoes. The severity of cases varies, but a substantial number of patients require hospitalization. About 20 to 30% of the reported cases need hospitalization, maybe because of severe symptoms or complications. The symptoms of these diseases are consistent with this seen through the previous years, like high fever, severe headaches, retroorbital pain, and a lot of joint pains, muscle pains, rashes, mild bleeding. But in few, severe complications like severe abdominal pain, persistent vomitings, rapid breathing, lot of bleeding gums, fatigue, restlessness, and maybe blood in vomit and blood in stools. So this year, compared to the prior years, the frequency and severity of dengue cases has increased, and the current outbreak in severe cases and complications may be potentially due to co-circulation of multiple dengue serotypes. Enhanced surveillance, vector control measures, public awareness campaigns, and deployment of medical experts to the affected areas has been intensified to manage this outbreak. And both travel-related and local transmissions are contributing to the rise in cases, emphasizing the need for preventive measures even in non-endemic areas.
Similar to Gupta, other doctors across states have been seeing this uptick in cases since the onset of the monsoon season. The severity of cases varies, but according to more than half a dozen doctors News 18 spoke to, a substantial number of patients require hospitalization, ranging about 20 to 30%. Experts believe that this year, frequency and severity of the disease have slightly increased, at least in the southern India. This means doctors are noticing an increase in severe cases and complications potentially due to the circulation of multiple dengue serotypes. These symptoms of dengue this year are consistent with those observed in the previous years. It is important to recognize symptoms early. High fever, severe headache, pain behind the eyes, joint and muscle pain, rashes and mild bleeding are the top symptoms. Severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, restlessness and blood in vomit can also be the crucial symptoms indicating the onset of dengue. Symptoms typically emerge 4 to 10 days after mosquito bite and can last between 2 to 10 days. Early diagnosis is crucial as the condition can rapidly progress to severe dengue. This severe form occurs when platelet counts drop and blood vessels are damaged, potentially leading to shock, internal bleeding and organ failure. While dengue is not a new disease and is something we encounter every year, here is an important reminder. Typically, patients begin to feel better once the fever subsides within 4 to 5 days. However, if they have not stayed well hydrated to offset fluid loss from fever and vomiting, complications might arise after 4th day. It is important to consume a lot of water and oral rehydration solutions. Also, if you feel feverish, medicines like paracetamol can help manage the symptoms. But in case of dengue-associated illnesses, which start with mild fever only, you should not consume painkillers or non-steroidal anti-inflammatory drugs like aspirin and ibuprofen, as they can increase the risk of bleeding, which is a serious complication in case of dengue. Hence, avoid taking medicines on your own. Keep your environment clean and hygienic so that no breeding site is available for dengue mosquitoes, and use mosquito nets and repellents to protect your family and loved ones.
Dengue fever is generally seen in the monsoon season in this part of the country, especially in Delhi NCR. With the onset of dengue, with the number of patients coming to OPD increases suddenly. Mostly the symptoms are high-grade fever with severe headache, pain in the eyes, bitter taste of mouth, severe body aches, joint pains, and these patients always present in the OPD with very high fever of 103, 104, setting on all of a sudden without any rhyme or reason. And the causative thing here is bite of Aedes aegypti mosquito, which is generally known as an urban mosquito, and this is very commonly seen in the monsoons. Now, these days what we are noticing is the number of cases with dengue fever coming to OPD has suddenly increased. Earlier we rarely used to see any dengue patients in the summers, but now every day we are seeing 3 to 4 patients coming to OPD with dengue fever. Today also in the IPD I have got 3 to 4 dengue patients, and these patients are managed basically with conservative measures. We just give IV fluids, maintain the hydration, treat fever with paracetamol, and we avoid using NSAIDs like Voveron, Combiflam or Diclofenac. These things are generally avoided to be given to these patients. These patients recover. The cycle of the old fever is around 8 days. The patient presents with fever for 4 to 5 days. Then there are 2-3 days which are known as complicated phase, which lasts around a couple of days, and then recovery starts on day 8. Generally the management is all conservative. 99% of the patient will recover if they maintain good hydration, take only paracetamol for controlling fever, and if you have symptoms like any bleeding diastasis, any blood in the urine, blood in the stools, then you should go immediately meet the doctor and get admitted for the management of dengue fever. The platelets are only given when the platelets fall less than 10,000 or there is any stigmata of any bleed anywhere. Otherwise, there is no need for platelets. So dengue, if managed properly with IV fluids, oral fluids, can be treated very easily. 99% of the patient will recover at home. Very few require admission. You should always see opinion of the doctor if you are sick and with very high grade fever these days.